Welcome everybody to dealing with the reopening in our fertility centers, the trauma and stress. And our guest speaker today is Dr. Mark Lerner. I'm going to put up the kind of our rules of participation. One of the things that we'd like you to do is to go to the chat room and click on presenters and participants and introduce yourself to all of us by typing in your name, position, and your location. We're going to start in just a few minutes. Welcome everyone to our webinar this week, dealing with reopening, this trauma and the stress. We're very happy to have clinical and forensic psychologist, Dr. Mark Lerner here as our guest speaker, and we're going to get started in just about 1 minute. In the meantime, if you would go to the chat room and introduce yourself by clicking on panel and all participants and typing in your name, position, and where you're located, it kind of gives us an idea of who our audience is. Remember, we want this to be as interactive as possible, and Dr. Lerner is certainly hoping that you will be asking questions. In order to do that, you can go directly to the chat room and type in your questions, and we'll make sure that we present them to him, as many as we can, and hopefully he can give you some answers. So give us just about 30 more seconds, and we're going to get started. Hi, everyone, and welcome to our webinar this week. We are really pleased to have as our invited speaker, clinical and forensic psychologist, Dr. Mark Lerner, and we're going to be talking about dealing with reopening our centers and the trauma and stress that it may cause and what we can do to make it a little bit easier. Hopefully you've all signed in on our chat room because we'd really like to know who you are, what you do, and where you're from. And I want to remind you that we want this to be as interactive as possible. So please, comments, questions, put them in the chat room, and Monica is going to help us get those questions answered by directing them to Dr. Lerner. Mary Vitsky, who's also with us from the Fertility Nurses Network, is also going to help, and you can send her information and she'll make sure that Dr. Lerner gets the questions as well. We want to do just a little bit of a setup for you. Oh, excuse me. And I want to go through just a couple of thoughts here. As we reopen, we know it's going to be hard, but wouldn't it be nice if it was easy as saying, you shouldn't be so worried all the time. You're doing just fine. And your patients, your staff, your coworkers would go, wow, thanks. You've cured me from my anxiety. But I think all of us know it really isn't going to be that easy or that short term, because just telling someone not to worry isn't going to make that worry go away. And not only do we have that to deal with, but we have got a lot of work to do. We've talked about that in the past few weeks. We've got policies and procedures, other documents we need to write. Patients are going to see things differently. How are they going to be able to enter our centers? Will they be able to enter their centers? Are there going to be limits on partners coming in or guests? Are we going to have even further pre-screening questions, temperatures, or even as some centers are doing, we're checking your oxygenation level with pulse oximeters. Our office visits are going to be really quick. We talked about we're getting them in, getting them out. And a lot of what we do with our patients is going to be online or telephonic. And there's going to be a lot of new procedures for us as well. What's wrong with this picture? I think the pictures we used to see, the visuals we had in our offices, all of us take a step back now and go, whoa, 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 she can't hug her. Those two nurses, doctors can't be standing that close. Where are their masks? Shouldn't they have gloves on? What about gowns? Everything looks so different now. Some of us may be meeting our patients out in the parking lot. Others are going to tell our patients to stay out in the parking lot until we call them to come in when there's nobody else in the office. Masks. Masks, more masks. I love this picture. Monica sent this. Where do we get them is an issue. Should we make our own? Is that sufficient? How do we wear them? A lot of mask protocols and checking. Please, everybody, cover your nose. And as a friend said, I can't wear lip gloss anymore. How about even makeup? When you take that mask off for any reason, interesting results. So things are changing visually. And our patients won't be able to see our faces anymore. And we may look like outer space aliens to them. Who's under all of that PPE, and how does that impact what we do on a daily basis? And there's going to be checkpoints. Everything stops. It's not as fluid as it was anymore. Stop to put your PPE on. Stop to wash your hands before you come in. Stop to clean our equipment, our rooms, etc. And no more touching. Elbow bumps. I love the foot shake. How about just a wave, or I'll hug you when I can? Touch is such a huge part of what nurses do on a day-by-day basis, and all other clinical staff. How many of you are embryologists or have embryologists that love to give the information about the pregnancy, and then the next thing they do is give your patients a hug? We can't do that right now. And what's that going to do to all of us? Stress looks a lot different to a lot of different people. We've had a lot of changes. We're going to see even more because this is such a fluid situation. So are we going to look half crazed, or more typically, are we just going to be overwhelmed? Because stress probably feels like, give me a minute to breathe. Let me figure out where I am. Where do I go for support? And so today, we're going to go to Dr. Mark Lerner for support, and I'm going to turn it over to Mary so that she can introduce him to you.
Well, welcome everyone. I have the pleasure of introducing Dr. Mark Lerner. I have known Dr. Lerner since 2010. We won't go into how old that I am now. He is a clinical and forensic psychologist, author, speaker, and international traumatic stress consultant. He focuses on helping people through challenging experiences. He is the president of Lerner Psychological Services, as well as chairman of the National Center for Emotional Wellness. He regularly provides practical information, training, support for organizations and corporations, educational institutions, healthcare providers, and mainly first responders. For over 30 years, Dr. Lerner has been called upon to consult with and train organizations, including private and public corporations, hospitals, pharmaceutical companies, airlines, police and fire departments, universities and schools, the FBI, the U.S. Department of Homeland Security, and the United Nations in New York, Paris, and France. I could go on. His most dedicated area is supporting traumatic stress and post-traumatic stress disorder. Dr. Lerner is a well-known author. One of my favorite books I will highlight is It's Okay Not to Be Okay. Dr. Mark Lerner, welcome to our webinar.
Well, first of all, thank you so much for having me. I appreciate Monica, Lisa, and Mary for inviting me to this important discussion. The last program that I had done, I was called in by the U.S. Coast Guard to speak with a group of men and women about suicide after the death of one of their members of service. And I went in there with my laptop, my MacBook Air, and I was all ready to hook it all up and plugged into the system, and that dreaded happening for people in the presentation world happened to me. It wasn't working. There was no way we were able to get the program up and running. But it ended up turning out to be a gift. And I learned from that program that we don't have to have death by PowerPoint and death by keynote slides and bullet points to have a very valuable and intimate discussion on such a sensitive topic. What is wellness? Well, you can't walk into a Rite Aid, or Walgreens, a CVS nowadays without seeing that word wellness up on the wall. And while preventing illness, keeping people healthy, and improving the quality of life is important, there's a critical component of wellness that we simply overlook, and that's our emotional well-being, and awareness, understanding, and an acceptance of our feelings, and our ability to manage effectively through challenges and change. When I look into emotional wellness, I immediately want to try to connect the dots with the population that I'm serving so I can tailor my program or presentation to the group that is with me. And as I think about the nursing and the population here today, I think of the challenges that you're going to face. Some of the challenges were just articulated in the opening by Lisa, but less time with people, becoming less personalized in your approach. Certainly having a face mask is going to change the feeling of closeness, and closeness in general will be an issue. People will not be able to have a partner with them like they were before in many circumstances, and walking into the waiting room and seeing people staggered in chairs about the room is going to be very difficult and present kind of a new normal. For many people, fertility is a form of traumatic stress. It shouldn't be confused with post-traumatic stress disorder. With PTSD, we see a serious inability to function in the world. Now, while that may be the case with some people with fertility stress, I don't want to give the impression that everybody that is experiencing fertility issues is rising to the level of an inability to function in the world. So I don't like the idea of rushing to label people and throwing in PTSD right away. A crisis is in the eye of the beholder. You know, for one person, fertility issues can be just an area of frustration. For another person, it could be devastating of a script that they have for their whole life. I plan on having children. I plan on having 3 children. I want to have a boy, a girl, and then I want to see what happens after that. Even having it all defined and all prepared. And for many of them, that script is shattered with fertility issues. It's also critical to understand that with traumatic events, it doesn't have to take a 2-inch newspaper headline to create a marked disruption in a person's life. People often think of stressful events and crises as overwhelming experiences, but a crisis is actually an individual's inability to cope effectively with the problem at hand. Here is where we can talk a little bit about self-care. We have to take care of ourselves before we can take care of others. If we're not in a good place, in a good frame of mind, in a healthy state, how can we begin to share and work with others at our peak capacity? Some of the techniques and strategies that I'm going to talk about today will be applicable not only to the people who you work with, but also to yourself and to your family members. There are so many kinds of traumatic events that impact people's lives, from losses through the pandemic that we're experiencing today. But I want to just focus for a moment on just the concept of stress. Stress can be a good thing. It can be helpful. It can motivate us. It can help us to give a dynamic program that I'm giving right now. For the first time, as I had explained with the ladies before this program, in a virtual world. My programs have always been live, so coming in with a level of stress is invigorating me and giving me this incentive to want to give more. For other people, stress can be a wear and tear and cause health problems as well. Living with fertility issues can cause traumatic stress for the patient, for their family, and for the healthcare provider or providers. In terms of looking at who is going to be impacted by the stress of fertility issues, it's always important to look at the before, the during, and the after. What kind of person are we dealing with? Are we dealing with somebody that has a history of traumatic stress, a generalized anxiety disorder, for instance, a history of anxiety problems or depressive problems, that this is just adding on as another burden? Also, prior traumatic exposure. Has this person endured something particularly challenging in their past? I found that very often in talking with people who are living through traumatic events, they're not only dealing with that event of today, but it opens the door to feelings of past and prior traumatic events in their lives. Then it's dealing with the moment, going into situations that are going to be very different than they were, going into offices where people, hopefully going into offices where people will be at a safe distance apart, where people will be wearing masks, where people will not be able to have physical contact with each other. For nurses, this is difficult because nurses are huggers. And this is going to be a tremendous challenge for you. What is happening also in the aftermath of finding out that we have fertility problems? I actually experienced this in my own life. Prior to having 3 healthy children, we tried for years and struggled and went through all kinds of tests before we were able to get pregnant. It wasn't until that hysterosalpingogram cleared the path and cleared the way, so to speak, that we were able to have my first child, my daughter. What are some of the reactions that people experience when faced with traumatic events and traumatic stress? Well, we have to talk about feelings, thoughts, actions, physical and spiritual reactions. In terms of our emotional reactions, we know shock, anxiety, numbness, denial. I could go down a list of all of the different emotional reactions that people face. The question is, what can we do about it? What can we do to help ourselves and to help others? First and foremost, find people who you can speak to. People who listen more than have all the answers and want to be the experts. To me, I'd much rather be the expert in helping somebody to try to find the answer within themselves rather than the expert in telling them what to do. Find people who are interested, keep a journal perhaps with young people, children, having children drawing pictures of what's going on, and consider speaking with a professional. These are all things we can do in terms of the emotional aspects. Feel free to jump right in, by the way, with any questions that apply, because I know I'm probably triggering some feelings as I say some of these points. In terms of our cognitions or thoughts, we don't think clearly when we're experiencing very traumatic events in our lives that are overwhelming us. This is not a time to make critical, important decisions, so turn to loved ones to help you in making critical decisions. We tend to have a short attention span. We tend to be suggestible and vulnerable, but that also can be a positive for a nurse who's involved in a person's life, who's offering suggestions at a time where somebody is very receptive to learning, what can I do to get through this? People may blame themselves, blame others. We may see levels of anger that we've never seen before, hypervigilance and perseverative thoughts, being unable to turn off these thoughts of what's going on in my life right now. I see your picture just popped up, Mary. Did you want to ask a question?
Well, Dr. Mark, I am a hugger. And I'm going to be a deprived person, not being able to hug my patients, as well as not having these patients bring in their new babies for us to hold, because they're not going to do that. And that's going to be difficult for a lot of us. What are some suggestions for us that are going to be hug deprived?
Well, that's a good question, and not an easy answer, because there's a new normal. When we're told that we have to keep a distance from people and we have to wear a mask, what I immediately did when I was in my office with people is I reached out and gave a symbolic hug. Instead of a handshake and elbow hug we did in the office. Ultimately, we ended up on screen, so I was giving virtual hugs this way, fist bumps this way, and elbows this way. So I think we have to adapt, to answer your question, to the circumstance we have. And I think we have to talk about it too, that it's okay to say to people, I wish I could give you a hug right now. I'd love to be able to. That shows that you're real and genuine.
Dr. Lerner, it's Monica. What about your thoughts? Lisa had put up a picture early on in the slides of people whose picture of themselves was sort of on their outside of them, if they're going to have masks or goggles or both. What are your thoughts about that, or something like that? Or what can we do to incorporate it? Maybe even add, not only personalize it, but add a little bit of levity to kind of an awkward situation.
Well, I think we're all starting to get used to, in some strange way, this new normal. As we wear masks, or when we go out of the house, we have to wear masks. We're supposed to be wearing masks. When we sneak into a supermarket during the late hours right before it closes, wearing masks. I think as it applies here, I think the population will be starting to see more and more of this, and the new norm will actually accept and expect people to be wearing masks.
Okay. And then, you know, I got questions before this talk, and continuing to do so. And if you guys want to write in the chat, you can change your name or change yourself to anonymous if you want, by the way. But a lot of staff are fearful of returning to work. And a lot of staff that are at work are, you know, resentful, for lack of a better word, of those who aren't returning to work, because maybe they'd like to be home with their families. There's a lot of there's not schools out and all that kind of stuff right now. So there's a lot of stuff to think about in terms of balancing. So how do we balance those both things? And what are your thoughts about, I guess, first about the staff that's fearful to return, and then the staff that is at the office that may be a little bit frustrated about that and maybe being understaffed as a result?
This is a very important opportunity for creative discussion and dialogue. We have to talk and use this opportunity with not only our families, but with the people that we serve. We have to be able to share with them deep down that this is hurting me. I'm scared. I'm not sure what to do right now. It's really coloring all aspects of our lives.
Dr. Lerner, this is Lisa. Going to something even more extreme and touching on the story you talked about with the Coast Guard, what about dealing with those coworkers who may get very, very ill? Or as in some of the hospitals, I'm in Chicago, they've lost coworkers to COVID-19, they've died. And how to help staff cope with such a traumatic piece of information that may come to them over a telephone or a Zoom chat, and they can't even be together to discuss their feelings and work through it. What can we do, since I'm generally on the management end, what can we do to help our staff who are going to deal with that? So it's kind of an extension of not even just being afraid, but something bad happened.
I think this is going to be the importance of normalization and validation of feelings. Given the circumstance that we're going through right now, it's going to be very difficult for us. And try to empathize with people, try to get at the feelings behind their words and try to articulate some of that. It's critical to get at the feeling end of it. So look, it's a new normal and we're defining the script as we move along.
So can you also add a little bit, there was some discussion earlier today on some of the network news about the unfortunate circumstance of the physician who committed suicide in New York. And she had been working, an ER physician working with COVID patients, had contracted the disease herself. And there's some information coming out that maybe COVID itself may be causing some psychological depression, etc. Do you have, I know it's all new, I don't want to put you on the spot, but I don't know if you have any information, because we are going to start to see patients that have recovered or staff that have recovered. And is there anything special we should be looking for that may be beneficial to all of us?
Well, in most cases, certainly not all, people, when they commit suicide, they've let someone or some people know that they're not in a good place. It's very rare that people commit suicide without having told in some way someone that they're in this bad place, in a bad way. So I think what's critical for us to do is check in on each other on a regular basis and check in on ourselves. Get to those feelings and be able to share them with us. Encourage people to talk with us. One of the things that I've been doing regularly is going through my phone and just literally texting my friends and colleagues, and how are you doing? How are you holding up? And that ends up with a phone call and a dialogue. I would encourage the same with people. Check in with people on a regular basis.
And Dr. Lerner, it's Monica. Sorry, Lisa.
That's okay.
I want to just go back to the staff that is, if you are like a manager at a center and you're talking to the staff on the phone and they do need help working through those fears, can we get some, like literally some things to say, maybe like some little, like almost to script it, or some practical suggestions? So I realize, empathy, but what exactly could we be saying to them on the phone? How do we approach it? What are the questions that we can ask that are open-ended and receptive, but still help us run our business?
Well, beyond the obvious, how are you doing? How are you holding up? I mean, those are critical questions. But I think what we can also use is what I call a validation technique. And it may sound very strange at first, but as you follow it up, it makes good sense. It could sound something like, Monica, from what you're saying, I'm glad to hear that you're having a hard time. And then there's a pause. Because if you weren't having a hard time, you'd simply be in denial or psychotic. You wouldn't be dealing with the reality of what you're going through. So giving people permission and validation to feel is so very important.
And is that what you mean by normalizing feelings?
Exactly. That's part of what I just did before. I took you through some of the feelings that are very normal for people to experience and try to let them know that it's not only okay to have these feelings, but you're supposed to have these feelings when you're faced with a challenging experience.
So maybe it's saying something like, I'm going to turn my video on so that this isn't weird. Or let me see if I can. Wait, it's only letting me, I can't turn my video. Oh, here I go. Hold on 1 second. Okay.
Gotcha.
It's not weird. I know it's weird to have like this voice come out of nowhere. So this might sound like what I hear you saying is that you're because really you're not sure what they're fearful of. They might say, I can't come in. And maybe it's that they can't leave their kids or they can't something. So you need to almost say, what I hear you saying is that you're fearful of, and restate it. So listen to what they say. Maybe not use why questions, maybe use how and what questions as opposed to why. And then restate almost like a verbal, like backtracking. So restate what they just said and make sure that what you said is actually what they meant to say.
Well, it's empathic listening. It's really listening for the feelings behind the words and then trying to communicate back those feelings to the person. So from what you're describing to me, Mary, it sounds like you're feeling very alone and very trapped right now and not sure what to do. It's very interesting when you do that, when you get at the feelings behind the words, very often the reaction that people will give you is exactly. And that's an affirmation that you've captured it and you're with the person, showing compassion and empathy.
And what if they say, yes, that's exactly how I'm feeling, but you're like, well, you need to come in anyway. Or how do we get to the next step? Like sort of, we want to know the plan. Like, can we say something like, can we build a plan in a stepwise fashion for you to come in? Because we still we want to hear them, but we also need to know as running a center, like what is their plan? Maybe they haven't thought about that, but that is, practically speaking, we still need to know, are they planning to come in? Do they want to wait a little while longer? How do we staff appropriately?
Well, look, there's a responsibility that we have as fertility nurses in the program that you have for people to follow through with it. And I think it's a matter of getting through those feelings, normalizing and validating them, and then giving them some direction. People are looking for direction too. They're not looking for somebody that's simply going to reflect their feelings, but also tell me what I should do.
And what does that sound like, that direction? Can you give us an example of that? So I told you that I'm scared, I'm fearful, I feel overwhelmed, and then you're the practice manager or the nurse manager. So what would that sound like?
And Monica, that's why, because you are scared and you're feeling so alone, that's why I need you to come in so we can work together and I can be here for you.
And is it okay to say you're scared too? I'm scared and this is new for all of us.
Absolutely, absolutely. We can self-disclose our thoughts and feelings. They kind of say when in therapy or counseling is it appropriate to use self-disclosure? When it helps the other person. And in this particular situation, I don't think that there's anyone out there that isn't scared of the pandemic.
Right.
Dr. Lerner, it's Lisa again. I have a question for you that's coming from our audience, and it really goes to how do we deal with what is feeling like bad news all day long when we're reopening and we've prioritized patients. So a lot of our patients have been told they have to wait. Now they may be told that they have to wait even longer because we're going to take a certain set of patients first and then move to another, you're in the second wave, if you will. How can we help staff learn ways to tell patients things they don't want to hear, maybe, in a better way? And how do we deal with, oh my God, one more patient I have to tell bad news to?
Well, this is going to be the new norm, as we say. It's not going to be easy, but it's going to be something that you have to do, and you have to do it with honesty, empathic listening, and compassion. Being real with people, I can't emphasize is enough, is going to be so critical. So people come away with a feeling like, well, at least she's telling me the truth. She's not beating around the bush.
While we're on the difficult conversation, I do think we need to be real with people. Do we need to make like a difficult sandwich? So like kindness, difficult news, kindness, or how do we deliver what might be difficult news? Some people might not have, a lot of places are requiring COVID testing prior to, within 2 to 5 days, let's say, of a procedure. The patient didn't have that done, or the patient's, the spouse didn't do what they're supposed to be doing. So we need to tell this patient that in what feels like an urgent way. So how do you deliver difficult news besides being honest and upfront, allowing yourself to be a little bit vulnerable? Do you do like a kindness, difficult no or whatever kindness thing, or what's the best way for us to do that, but quick, relatively quickly and in a acute setting?
Maybe building somewhat of a hierarchy of getting across that information that you need to deliver would answer that question best. Working your way up to, this is what we need to do now, and I need you to understand this, but it could start certainly at a feeling level first.
And so what would that sound like?
Well, in dealing with people who are facing traumatic events, very often you're dealing with a lot of emotion. And one of the things that we try to do is get people out of an overwhelming emotional place and bring them into a cognitive or thinking place. And that's what you need to do here. You need to acknowledge the emotion, be there with the person, acknowledge what you're feeling, and then shift into, okay, so what can we do about it?
And so the sort of physiology of that would be, we're in this fight or flight response, which shuts down the prefrontal cortex, which is our critical thinking, logical, whatever response. So we really want to get back out of that fight or flight in some way, meaning patients and staff and anyone, because once we're in that, the ability to critical think and really, you're just on that, acute stress response. So is there a simple, easy way to get out of that, either by talking, by breathing, both? How do we get into and get our patients or clients into this logical prefrontal cortex space?
Well, I think a lot of it will depend on the intensity of the emotion. If the emotion is extreme and somebody is at a level of panic, some deep breathing through the nose, holding it for several seconds, and then slowly exhaling through the mouth. I often like to add color into that imagery. Imagine a light blue color coming out of your mouth. Reason why we do that is we're getting them out of that kind of left hemispheric thinking and overthinking and getting them more into right brain mode with the imagery of color.
Right, because the other thing that sort of innervates that part of the nervous system, the parasympathetic that we're talking about, is connection, is touch. And so we don't have that, we don't have that aspect of it. So any of these other ways that we can employ without those things to get that patient into that rest and relaxation part of the autonomic nervous system and ourselves. Now we're going to be breathing deeply in these masks, right? So just like it's just going to be so different. I think we're going to end up having to adjust and maybe having 10 things that might are possibilities or tools in the toolbox, so to speak, and then we end up picking a couple depending on the situation.
Exactly. And starting with talking with people is the place to begin. Starting with talking with loved ones and sharing what's going on in your life is so critical. I can't emphasize it at the most.
For our self-care, you're saying?
Correct.
For our, yeah, okay.
Absolutely.
Monica and Dr. Lerner, if I can take your talk about self-care and expand it a little bit to practice care, if you will. I know Dr. Lerner, that you've done a lot of work with acute traumatic stress management, and you have some models that you've used. I don't know if you've had an opportunity to apply any of this to the trauma of a COVID-19 pandemic and what it has done to our medical community. But I know a lot of our participants and myself as a manager, risk manager, we're looking at creating disaster plans, if you will, for if our location becomes a hotspot or if something happens in our office. Do you have any suggestions for how we create these plans and actually put them into action?
Could you help me to be a little bit more specific with that?
Sure. Well,
That's where I got you.
we've talked about on other webinars how you can reopen your practice and how you have to have PPE and, you know, how patients may be walking through your office differently in that. But I know you do a little bit more, my understanding, global type of how do we put a management system in place for trauma, stress, something that's in an acute phase. Most of us are still in the acute phase of the pandemic. I'm in Chicago. We have not peaked yet. We thought we did, and we haven't. And so how do we as practices, as practice managers, help develop a model to deal with this acute phase and then perhaps a plateau phase? We're looking for kind of, how do I get to a plan when some of us are like, oh my God, I can't even buy masks because we can't. And maybe you can help us from a theoretical perspective. How do I get to a plan?
Well, you brought up the fact that for many years I've talked about acute traumatic stress management.
Right.
And this was a model that I had created actually out in the field. I went out riding with police and in ambulances to see that first point of contact and what is it that we can do beyond saying everything's going to be okay, which was the typical out there, where everything is not okay when somebody is looking down and they see their leg dangling in a car. So I developed this acute traumatic stress management model that is really very applicable here in terms of connecting, grounding, supporting, normalizing, and preparing people. So, I mean, I can go into a little bit more depth with that if you'd like me to do that.
Well, and what if we, you know, and Monica, Mary, help me with a hypothetical situation such as we have a patient, we're getting them ready for an IVF cycle, and some places are testing and, oh, she's symptomatic now and she's positive for COVID. And what are we going to do? This is, you know, the nurse in the office may be the one telling her your test came back positive. She's now out of our system, probably going into a public health system of tracking. How do we deal with all of that? And I don't know if you've applied it in this situation, so I'm kind of putting you on this spot. I apologize, but I'm tapping that experience.
We're in new territory. We really are. We really have to use the skills that we've utilized in the past and other experiences and apply them in this particular experience.
Okay, so some of the things that you would do, say, out in the field would be the same is, and I'm just kind of guessing here, to identify what they're going through is one, not where they wanted to be and obviously horrible for them. And then do you know, take it from there to the people that are dealing with them to like come up, as Monica suggested, a script, a formula, something to fall back on to make us feel more comfortable about how we address it?
The formula that I would apply would be the connect, ground, support, normalize, prepare. In terms of connecting with people, really connecting with the reality of their situation, and then working to normalize their response to that reaction that they have. Connect, ground, support. We have to help to deal with the emotions that the reality of their situation is going to bring up and stir up. And then normalize and prepare, and ultimately normalize and prepare people for the future. Help people again to know that what you're going through is what you should be going through given the circumstances, and then ultimately help prepare people to know what exactly are you going to face as you move forward. So you're taking that fear of not knowing away.
Okay.
So
My
what
advice
would some statements in this, sorry, Lisa, might be saying when you're trying to really connect and normalize, let's just go through the steps just so, I really feel like we work so much better with like a couple of words, because then we can just make the stuff up. But the C, G, S, and P are not lending themselves to like a good word for me to use. So an empathetic statement might sound something like, let's say, go back to the example Lisa gave, somebody's positive for COVID, we're going to lose them now to a different system. You know, we are really busy, by the way, let's put into the context of our new normal, which is getting all these consents that are recent, maybe making more phone calls than we've done before because we have less time to spend with the patient in person. So now we have more phone calls. And, you know, honestly, we don't want to add more to our day. We want to make the connections we have be more worthwhile and quality than have more connections to be made throughout the day. I don't know if that makes sense, just practically speaking, because we're all kind of so probably understaffed still and definitely overworked at this point. So an example of a statement could be something like, in this situation Lisa gave us, you know, I can imagine, let's say that you went over how are you feeling right now? It sounds like to me that from what I hear you saying, you feel frustrated and overwhelmed. Then maybe your statement that would be a connection or grounding statement would say, I can imagine that you'd feel that way. Anyone would feel that way. I'm so sorry this happened to you. What other statements like that can we say?
Well, it's connecting first. What is my role in this, and why am I with you, and why am I here for you? Then grounding people by talking about the facts of what we're facing right now, what we need to do factually, connect, ground, provide support to deal with the emotions in dealing with those facts of what we need to do right now, connect, ground, support, normalize that response, if you will, that what you're going through is going to create a reaction that anyone would have difficulty dealing with. You're not unusual in that aspect, and ultimately prepare people for the future. What should I expect? What's going to come next? So you're taking that uncertainty away.
And let's say that the staff starting to get overwhelmed, let's say a week or two into this, what kind of strategies can we have for staff at our offices? What works? We can't really do, you know, the small groups unless everybody's sitting a little bit further apart, but how can we realistically support our staff that are absorbing all of this stuff? So we're being empathetic, we're putting ourselves really out there. It might cause a little bit of, you know, exhaustion, sort of mental exhaustion on our part, compassion fatigue, right? And so how do we as a center support our staff who are going through this? What can we be doing on a regular basis at our centers?
The single most important thing that you can do is get people together and have the opportunity to talk in a safe place, and really encouraging people to share their thoughts and feelings without worry about what they say could be used in some way to hurt them. What we're going to talk about today will stay in this room. That's an understanding that we have. We're going to share among each other. I've been in many situations like that, countless situations like that, where people then will start to open up and getting at some of those feelings that others in the group are having, and it can be a very productive dialogue.
So are you envisioning a peer-led support group, or if we have a mental health counselor that works in the office, that mental health professional would be able to lead that?
Both can be very productive. Having a mental health professional can certainly be there as a facilitator, but I've seen some very effective peer group support as well. So I would definitely not rule that out.
Right, and that could be potentially virtually if we needed it to be. If we can't get into a big room where everybody's sitting apart, that potentially could be virtually a peer-led support.
Exactly. You know, years ago, I worked in the schools. I worked my first 17 years of my career before the last 15 years, which I have now left the schools. I was in the schools, and every time we had some kind of a traumatic event, a crisis, something significant happened, we all knew that we would meet back in psych services in our area, and we would sit down and we would talk through what just happened today. It wasn't something that we had to think about whether we would have a discussion or whether we would schedule it. We knew at the end of the day, we would sit down and we would talk about it. And I think that that's something that we can add in and build into here, where there's a regular opportunity to share thoughts and feelings.
So this kind of goes back to the prefrontal cortex part, right? Where you have trouble making decisions, you're gonna automate as much stuff as possible. So maybe in this way, we're gonna automate Wednesdays at noon, we're gonna have this group. Whoever wants to come in, it's a safe place, it's a peer like group, if a mental health counselor wants to come in, but every Wednesday at noon or whatever is good for you, this is when we're gonna have it. That way there's no like, let's send this email out. So we can get that automated. That's less thinking, you can show up if you want. There could be 2 people in there. There could be, if that one person goes in there, they could have their lunch, but this is what's always available to you.
Absolutely. I would build that into the repertoire and use that regularly.
Okay. And then the other question that we had, which is interesting, is so a lot of people on this call are not necessarily nurses that work in a center, but have a tangential relationship or a consulting relationship with us, maybe pharmaceutical reps. Some people work with agencies who provide donors or gestational carriers. So they have a relationship with us. Some of it requires coming into the office just for contact, communication, collaboration, keeping up the connection. That's no longer. Lisa, it's true right now that we're, if there's a pharmaceutical or drug representative, that they're not going to be able to go into the office for a little while for risk management, I'm assuming.
Yeah, we're not allowing him in our office, Monica.
Okay.
Right. Most practices are saying no guests, and they're considered guests.
Okay. So how do we keep a connection with our guests? Let's just call it that. And how do they keep up their connection with us? You know, we're busy and we're in this like fight or flight that we've been saying, and this might feel extra, but this is their role too. And they're important to us, and their products and services are important to us.
Well, circumstances force us to adapt. For instance, as I said, you know, after 30 years of speaking to all kinds of groups of people, this is the first time that I've actually done anything in a teleconference kind of way. So it's very new to me, and it's something that people will learn. This is the new normal. This is what we have to do, and people will come to expect it.
And so maybe one of the conversations is just basically saying that. We don't know what to expect. We're going to have to figure out this together. We're going to make a lot of mistakes. We're going to have to make a lot of adjustments. But this is something that we're going to have to figure out how it works and doesn't work.
Exactly. Keeping it real and being honest with people, I think, is going to be critical.
I also think that there's going to be a lot of wanting to email or send through a portal instructions because of, first of all, you not being able to have face-to-face for that long, and just there's just a lot of talking. Like I feel like, you know, if you have 3 or 4 Zoom calls a day, by the end you're just exhausted, and then phone calls. So is there something we should put in the beginning or the end of an email? So right now, a lot of people's emails, because I see a lot of them, they're automatic replies. Due to COVID-19, please expect a delayed response. And I think that's reasonable and applicable and good. But, you know, is there something that we should put that's a little bit more of a personal message on the email? Like something, we know you're going through something right now, or should we say something like that, or only address it if the person seems to be having trouble, issues, feeling overwhelmed?
You know, and I often say that expression of feelings, there's no downside to. Withholding feelings is withholding the truth. The feelings reflect our deepest sense of who we are. So sharing that and encouraging people to share their feelings with you, I think is a must, especially now.
Right. So if it's an email communication or a portal, which is basically goes through the electronic medical records encrypted as an email, what would a statement on that email say? Let's say it's not good news, or something that is not so great, and we tried to reach them, or we reached them and now we're having a confirmation email. In this time where everybody feels so much uncertainty and it's a little bit raw, both the staff and the patients, what could that line be on that email? What can we say? Or is there anything we should not say?
I think what you just said is very real. During this time of uncertainty, we're working our way through it, and stay real with people. And I think that that's critical. That's one of the things that people have a problem with the press conferences that we hear today, that we're not getting the truth. We're not getting what's real. And that's what people are looking for. They're looking for facts.
So stay real is sort of the stay authentic and upfront with information is sort of our kind of buzzword. So we have another question. What about a specific closing statement that doesn't feel flippant? Like we don't want to be like, hey, talk to you soon. See you next week, which is what I'm putting that I think is so rude. And these like quotes, which is what I'm writing. That's why I'm saying that, because it's just a Zoom call, right? So see you next week. Like, what could the closing statement be that feels honest and warm, or something like that, that doesn't feel, it feels like it's taken into account that person's feelings when we're kind of signing off on an email?
I think as long as it's authentic, Monica, that's what's critical. That it's coming from the heart, it's real, and this is how I'm saying goodbye to this particular call. This is what I've been doing with the sessions that I have regularly during the daytime hours with people at the end. So I'll see you next week. Have a good week. Stay safe. I'm here for you.
That's what somebody wrote on the chat. Stay safe, or hang in there. So maybe the I'm here for you is a good
Exactly.
way to add there. Okay. Does anyone else have any other questions for Dr. Lerner before we close with a little, hopefully a little, we'd love for you, Dr. Lerner, to do a little breathing kind of exercise to really, for us and for us to maybe show our patients. But before we do, does anyone else have any questions they wanted to write either in the Q&A or the chat for Dr. Lerner? And Dr. Lerner, I'm sorry, one more question from me. In terms of the that strategy that you were telling us about, the connect, the prepare, is that anywhere that we can get a copy of that?
It's actually on the website for the National Center for Emotional Wellness under the link info sheets.
The Emotional Wellness website or your name website? The Emotional Wellness website?
National Center for Emotional Wellness.org.
Okay, I'm putting that in the chat.
Yep, there's a lot of great information on that website that's Dr. Lerner makes available for us. So I encourage people to visit that website. Dr. Lerner, there's one thought I had when we were talking about face masks, and that is we can't hug. They can't see our smiles. We might be smiling under our mask. So I've reminded the patient, I'm smiling right now. I'm giving you a hug, virtually, whatever. But our facial expressions are being obscured by the mask now. So people are looking at the eyes more. And I think we have to remember our tone of voice when we're speaking because they're not seeing our entire face. Is that a good point to make?
That's an exceptional point to make. It's something that honestly I didn't think about myself until you just said that. Look, this is going to create all kinds of challenges, and it is creating all kinds of challenges. And the fact that you're here talking about it and trying to get answers just shows a desire and a need for thirst for information. So I would have more talks like this, speaking with other people who have experience out there in different areas to really get the answers that you need.
I would love it if you would close our session with you by doing one of your breathing exercises. I had the great opportunity of sitting with you for an entire week through training, which was a great gift that was for me in my career. And one thing I've always taken away is how you taught me a new way of deep breathing. And you mentioned the color. And from this day, and it's been 10 years, I deep breathe with that color image in my brain. And it does make such a difference. I'd like the participants to experience that if you're willing to share that. with us, and then we could close with everyone going, relaxed and deep breathed.
Well, okay, certainly we can do that. You know, just before we begin, little subjective units of distress subscale would be interesting if you wrote down a number right now of where you are from 1, you're comatose, to 10, you're in a state of panic. Please help me, get me to a hospital. Where would you rank yourself right now? And just write that number down. And then what I often do with people is I'll say, what I'd like you to do is just get yourself in a comfortable place. Just sit in a comfortable chair, hopefully, and close your eyes and just listen to my voice. I'd like you to take a slow, deep inhalation through your nose. Hold it and feel the tension in your body. Feel the tension in your shoulders, in your neck, in your mouth, in your jaw. And now slowly exhale through your mouth. Once again, a slow, deep inhalation through your mouth, through your nose, and hold it. Feel the tension in your shoulders, in your upper body. Feel the discomfort and feel the tightness. Now this time, blow out through your mouth a beautiful blue sky. Slowly exhale a beautiful blue sky. And just one last time. A slow, deep inhalation through your nose. Hold it, feel the tension, feel the tightness in your upper body. Really be aware of it. Now slowly exhale, release that tension. A beautiful blue sky through your mouth. For most people, when I ask them afterwards where they would rate themselves on that subscale, they're 1 or 2 points less than they were before. Is that your experience?
Yes. So I went from a 6 to a 3. So,
Okay.
because I have all these COVID screening calls that I have to make. So I'm all in a better mood now.
Certainly a very, very powerful technique.
It really is. And I want to thank you for joining us today. It was truly a gift to have you be present during this webinar. And Monica and Lisa, do you have any closing remarks for our participants?
We loved it. We already have some great feedback. And so what I'm going to do is I will send this out recorded, a link to your recording. I'm going to eventually put it on YouTube because the link's only good for 2 weeks. But I'm also going to include some of the links that Dr. Lerner referenced. So I'll put them in like as at the bottom of it so that you can actually click on the link and hopefully get to you know, some of the stuff that we discussed in terms of those websites. You can have that all at your fingertips and share that with the rest of your practice.
And I just want to say thank you again, Dr. Lerner. I add my thanks, and your thoughts are much appreciated as all of us try to get back to business. To everybody out there, be good to yourselves. You're going to do it. And even though it won't be perfect, we're going to be here to try and answer any questions and give you as much support as we can. So thank you for joining us. Have a wonderful week.
One last thing,
So
so sorry. We're going to take a little breather of a couple of weeks so that you guys can have a breather and you don't go have webinar fatigue. But please feel free to ask us what you want to hear about, let's say in 2 to 3 weeks from now, so that Lisa and I and Mary can make it, you know, personalize it to you. But we will do that for a couple of weeks just so you know we're not off the grid.
Okay, everybody take care.
Thanks again, Dr. Lerner.
Take good care. Be safe.
Bye-bye.
You too.
Bye-bye now.
We'll get through this together.